Now, resident doctors have today voted to go ahead with strike action, while the British Medical Association has accused the NHS of putting patients at risk. Let's speak to Rory Deighton, Acute Director at the NHS Confederation. Thank you very much for being with us. So, the BMA, first of all, saying these strikes will go ahead. Is the NHS prepared?
Absolutely, Mark. The NHS is prepared. The NHS has sadly become very good at dealing with strike action. I think 44 days of strikes over the last couple of years. There will be lots and lots of preparation for this set of the preparation will start perhaps a week before. We'll run for the 5 days of the strikes with strategic level, exec level oversight, meeting twice a day, and then an operational group in each trust across the country with senior clinicians, senior operational leaders, communications and HR staff, all coordinating the response to this strike action. So yes, the NHS is very much prepared.
What about the suggestion from the BMA that consultants who will be taking over or filling in, I guess, will be stretched too thin because not enough routine treatments are being cancelled? What is happening about that?
Well, NHS leaders will put patient safety at the absolute core of their response. Safety is absolutely the priority for patients. But we've got really very good now at designing and redesigning and reassessing risk across the NHS, and that's a common thing for NHS leaders. And NHS leaders believe that they can keep more elective care going across this period of strike action. It'll be different in different trusts. If you're in a specialist trust, you don't need as much to cancel as much activity in order to maintain services. So I think there's a belief that more elective activity, more pre-operative work, more post-operative work, more diagnostic work can continue throughout this period. So risk management, safety management is bread and butter to the NHS, and right. NHS leaders are keen to keep going.
Right, I'm told that NHS trusts are not being encouraged to ask resident doctors which ones are going to strike, which ones aren't. Is that right? I mean, do you have any idea how many resident doctors are going to strike, or do you assume that all will?
It's really difficult to tell. And I think one of the key areas over the next 24, 48 hours will be reaching some sort of understanding on which are the critical and the key services that we can agree with the BMA will be maintained and will be fully staffed. So emergency departments, intensive care, some cancer services. That's likely to be a focus of the discussions over the next 48 hours or so. But there's a real commitment from NHS leaders to maintain progress on elective recovery. We've seen a reduction in that waiting list down from 7.5 million to about 7.3 million, a real incremental gradual improvement and a reduction in those waiting lists. And leaders are keen to keep up that progress, keen to keep up that positive direction. And when we talk about risk and when we talk about harm, there is risk and harm in people attending hospital over the strike period, but there's risk as well. There's harm happening to patients who've been on waiting lists for a long time. So NHS leaders are keen to keep up as much elective activity as they possibly can during the strike period.
Right, and is it true that doctors covering the strikes will be earning up to £300 an hour? Is that what it's going to cost?
Well, it's going to vary in different parts of the country. Again, safety and patient safety and keeping patients safe is the absolute priority. If you can do that within your existing staffing resource, then leaders will do that. But if they need to be paying additional rates, then that's just what they have to do. Patient safety will always be the absolute priority during the strike period.
Are those the sorts of rates that you've heard being talked about?
There is significant concern about some of the rates that are being paid. We're working in a constrained NHS, a financially constrained NHS. Achieving financial balance at the end of the year is really important to the NHS. Okay. So those sorts of figures are really, really difficult in that kind of environment. Yeah. But it is patients and it's patient safety that the focus will be on, and it's thinking about this strike action from a patient's perspective in terms of safety on the day, but also in terms of cancelled appointments and the harm that comes to patients over these strike periods.
Rory Deighton, appreciate your time. Thank you very much.